Hello, I'm Justin Gallagher.
And I'm Sarah Stewart.
Welcome to This Week in Managed Care from the Managed Markets News Network.
Our top story is Aetna's $37 billion purchase of Humana, which comes on the wave of consolidation in the healthcare industry. The combined company would have more than 33 million members and annual revenues of $115 billion. 56% of its business would come from government, especially Medicare, which is a growth area as baby boomers age. State and federal regulators must approve the merger, which is projected to close in the second half of 2016.
The Government Accountability Office has found that a drug discount program created to help safety net hospitals is driving doctors to prescribe more drugs and more expensive drugs, particularly in cancer care. Hospitals in the 340B program spent more than twice the amount of those outside the program for each person in Medicare Part B. Growth in the 340B program has been blamed for rising healthcare costs, as well as the loss of independence for many community oncology practices, which cannot compete with the drug discounts. While hospital associations criticize the GAO report, experts at our recent Stakeholders Summit said that growth in the 340B program is one of the factors behind consolidation in healthcare, which will drive up costs.
The problem is that we're seeing a number of factors that are causing consolidation, but both on the Medicare side, not just with oncology, in other areas of medicine, certainly on the private pay side, consolidation is costing. So how ironic is that what is the ACA supposed to do? Really, what are they really the underpinning? Is to reduce costs. Yes, we'll make sure we take care of quality so we don't repeat the 90s, but we want to reduce costs.
CMS has proposed new rules for Medicaid managed care that would increase state reporting requirements, and critics have asked whether the agency has enough manpower to handle all the data. Those who oppose more reporting got some fuel for their argument this week when the Inspector General for Health and Human Services found that 8 states failed to report any managed care data for 2011, but CMS accepted their reports anyway. Other states reported some data, but not all the data that is required. CMS has the power to withhold federal funds from states that fail to meet reporting requirements. The Inspector General called for this step to compel states to provide data.
In just a few weeks, the first debates of the 2016 presidential election season will begin when candidates for the Republican nomination take the stage in Ohio. The future of the Affordable Care Act is expected to be a topic. But Ovik Roy, a senior fellow at the Manhattan Institute, told AJMC recently that partisan arguments over the ACA miss the point.
My view is that we shouldn't just be arguing about Obamacare. We should be arguing about everything in healthcare. Because if you think about it, the reason why our healthcare system is so expensive is not because of Obamacare. That's a relatively recent law. It's because of Medicare and Medicaid and the employer tax exclusion, the way we sponsor employer-sponsored coverage. So those are the 3 things you have to really reform. Those programs from World War II and the Great Society, those are what are driving a lot of the problems we have. Obamacare kind of doubles down on a lot of those problems in my view, but it also provides openings for a better set of reforms.
If you could not attend this year's meeting of the American Society of Clinical Oncology, please be sure to see our special issue of Evidence-Based Oncology, which reports on major findings, upcoming clinical trials in precision medicine, and reports from experts on how the move to value-based medicine is affecting cancer care. To read the issue online, visit ajmc.com.
For the Managed Markets News Network, I'm Justin Gallagher.
And I'm Sarah Stewart.
Thanks for joining us.